While I've never gotten to take a class from Don Moniyhan, I, like many of you in the audience, have been a student of his research and was definitely in the proverbial master class on friction working on unemployment insurance modernization in Illinois during the pandemic. Don's leadership of the Better Government Lab, first at Georgetown and now at the University of Michigan, is changing the way we think about how government can and should work. And it's an honor as an employee of Georgetown and a proud alum of the Ford School to introduce him today. Don Moniyhan is the professor of public policy at the University of Michigan's Gerald R. Ford School of Public Policy. He previously served as Georgetown University's McCourt School of Public Policy Chair of Public Policy. Don's research seeks to improve how government works by studying the administrative burdens that people encounter in their interactions with government. He co-directs the Better Government Lab, which looks for technology and other interventions to help government improve access to the social safety net. He's the president of the American Public Policy and Management, Association of Public Policy and Management. Don has presented his research to policymakers at the U.S. Office of Management and Budget, the World Bank, the World Health Organization, the United Nations, OECD, and the Government Accounting Office, as well as governments around the world. His writing and research has been cited in President Obama's and President Biden's budget proposals, OMB policy guidance under President Biden, and in the media such as the New York Times, Washington Post, New Yorker, and Atlantic, and many other publications. And he is the author of the blog, Can We Still Govern? Please join me in welcoming Don Moniyhan.
Thank you all. It's wonderful to be here. I'm going to walk around a little bit. Thanks for having me here at the Beck Center. It's always an exciting opportunity for academics to wear the suits that they have in their wardrobes. I mean, normally we don't get that, so this is terrific. This is a great network of people that I think 10 or 15 years ago didn't exist, which includes people who are doing the tech work, includes people who are working on safety net, and also includes some academics and researchers who are talking to one another about how to make government services more accessible. What I'm going to talk about in the next 20 minutes or so are the topic of administrative burdens. You may have heard about those before. Whether you know it or not, all of you are involved in fighting administrative burdens in your work. And so it's maybe useful to sort of talk about what they are in practice. Then I'm going to talk about a couple of examples of research that we've undertaken with colleagues here at Georgetown and in other places with Code for America to reduce administrative burdens, and conclude by talking about a couple of lessons. So this topic of administrative burdens is relatively new as an academic research area. It sort of emerged over the last 10 years. A shout out to Pam Hurd, who co-authored the book Administrative Burden with me in 2018. What does administrative burden mean? It essentially is defined as people's experience of policy implementation as onerous. And to break that out a little bit more concretely, we identify three types of costs that people can experience. One is learning costs, the second is compliance costs, and the third is psychological costs. So learning costs, you have to find out about some sort of public service. You have to figure out if it's relevant for you, what you would have to do to apply for it. We're not born with this knowledge, so it takes some time and effort to actually pull it together. Negotiating and thinking about public services can be more or less onerous. This is a map of the choices that Medicare beneficiaries have to make every year when they try to choose which plan is appropriate for them. There's obviously a good deal of cognitive labor that's involved in this for a population that is generally older adults. And so what happens most of the time is that they stick with the default, the plan that they already have, whether or not it's actually the best plan for them. Compliance costs are what we think of sort of classically as red tape. So filling out forms, providing documentation, maybe there's some financial costs that you encounter in complying with the sort of rules and requirements of administrative actors. And I'm going to show you a chart that I think many of you will be familiar with, which is about the effects of the public health emergency and the great unwinding as that period came to a close. So we had this thing called a pandemic, and for a couple of years, we changed the default about how people engaged with Medicaid. Rather than requiring people to renew their status every 12 months or every 6 months, we said, okay, as long as the public health emergency is going on, you will not lose your Medicaid coverage because of that renewal stage. And so this was sort of an unplanned experiment in what happens if you make public health services less difficult to access via the enrollment process. What we saw is a ballooning of coverage of Medicaid to just over 90 million people. One study found that this had a similar effect in terms of expanding coverage of the uninsured in America as Obamacare did. So think about that for a second. Simply not requiring people to go through the paperwork process each year had a similar effect as the most visible and controversial and impactful policy change in the health policy we've seen over the last several decades. One thing I want you to note from the graph here from the Kaiser Family Foundation is that you see significant variation in the loss of enrollment across states. And so that suggests that maybe these compliance costs or the ways in which people are responding to them can vary and can be made more or less difficult. Altogether, about 25 million people have now lost Medicaid coverage at the end of the public health emergency as these re-enrollment processes got put back in place. Lots of variation by states, but also there's a lot of variation in terms of who got to stick around and who didn't. One thing we found out is that on average about 70% of people lost coverage for what's defined as procedural reasons, which means they weren't able to demonstrate or the state could not figure out for sure if they were or were not eligible. And I think that represents a certain amount of failure in terms of our ability to know whether coverage is or is not going to the right people. The third category is psychological costs. Here, think about the emotional responses we have with our interactions to the state. This could vary from stress and frustration to experiences of maybe stigma or fear. This is a text message that a friend of ours shared from her niece during the pandemic, where the niece had lost her job, was looking for food stamps, and was not just experiencing frustration here, but also that frustration was shaping how she thought about government. And so the point is that these psychological responses can then change the way in which we think about our relationship with government. Do we trust it? Do we think it's trying to help us? Or are they deliberately making things hard to access? These ideas of administrative burdens have gained some currency in government, and if you're sort of working on this topic, there's never been a better time. We've heard some examples from states already, but you also can look at the Biden administration's Customer Experience Executive Order, the White House Administrative Burden Reduction Initiative, guidance from OIRA, an agency that historically is best known for doing cost-benefit analyses of regulations on businesses, but is increasingly paying attention to individuals' experiences of the state and trying to measure those frictions. Within those frameworks, we also see prioritization of types of skills that would not have been discussed, again, say 10 years ago. And you can go back to the Clinton administration and see presidents talking about customer service. That is not new, but the way in which customer experience is being discussed today is different, in that it prioritizes burdens, in that it thinks about who are the people who are not getting to the service, not just the people who actually make it through the process, and it's thinking about specific skills like human-centered design. So here, the Biden administration Customer Experience Executive Order specifies that we are going to pursue human-centered design in how we're doing things. And I think that's a testament to some of the people who are in this room who have been playing a role in getting government to think differently about the relationship between the citizen and the state. So I'm going to transition now to talk about a couple of examples of research. I'm a researcher, where we have tried to figure out ways to reduce administrative burdens. And this is very much a collective effort, so there's colleagues here, Sebastian Yilka is in the room, others at Georgetown, Johns Hopkins, Code for America, I'll talk more about their role, and the University of Michigan, where I sit now. A couple of examples I want to talk about. First is going to be based in Boulder, Colorado. In both cases, we're working with Code for America, where we're serving as evaluators for the work that they're doing. In this first example, I want to talk specifically about human-centered design. So Boulder, Colorado wanted to increase take-up of SNAP, and so it invited Code for America to partner with them. Code for America did the heavy lifting of going out to Boulder, Colorado, sending teams, talking to caseworkers, talking to advocacy groups, observing clients, and trying to figure out where were the pain points that could make it easier for people to negotiate administrative burdens in SNAP. The conclusion they came to that the biggest pain point that could be solved was the mandatory interview process. So if you're on SNAP, you have to apply, and then if you submit your application, you're invited to complete an interview. If you do not complete that interview within, I think it's 30 days, then you're sort of kicked out of the process. And what they observed in Boulder, we know is generally true in other places as well. This interview requirement is a huge administrative checkpoint. If you don't make it past this barrier, you sort of lose out in the process. And other work has sort of pointed to these effects as well, so we're drawing off that. The County of Boulder was interested in a couple of things. One is, how do we better utilize text-based communications to people who are applying to SNAP? But also, they had just moved to a situation where instead of requiring people to do an interview at a specific time, at a specific day, they were moving towards flexible interview approaches. Most people who are applying for SNAP are not going to know about this, so simply using text-based communication where you can tell people that, hey, there's this new way in which you can be interviewed for SNAP, and you can reschedule your interview, or you can call anytime. That was the intervention that we in Code for America developed. So one group here, the control group, and we talk about control and treatment, engaged in our sort of randomized control trial here. The control group gets the standard messaging that everyone who's applying for SNAP in Colorado does, which is a mailer saying, we've gotten your form, here is your interview time. The treatment group gets that, and they also get some text messages saying, did you know you can also call anytime to reschedule your interview within the 30 days? And here's what we found. So the treatment group were both more likely to complete the interview process, and then as a result of that, were more likely to be approved for SNAP by about 6 to 7 percentage points. And that is a relatively large effect for a nudge here. Digging into the administrative data behind this experiment, we see a couple of things. One is that the people who got that information about flexible interview processes were more likely to schedule their interview earlier ahead of time. And so they were less at risk of running up to that 30-day deadline and then not being able to reschedule their interview. And so that's where it seemed to make a difference. We also instituted a follow-up survey with people who are part of the research project here. And what we found is that people who had been in the treatment group who'd gotten the text felt greater confidence that they knew what to do and also were more aware of the interview requirement. And so we think about this as a way in which learning costs and maybe some psychological costs were reduced, where people felt less stress or less uncertainty about the process. So that's example one. Our interpretation here is that nudges are great, informational nudges are great. Sometimes they have an effect and sometimes they don't. We think we're seeing a larger than standard effect here, partly because this is news you can use. you're giving people information about how to manage or bypass an administrative checkpoint that typically they struggle with. So conveying that information persuasively to them helps them to get to the next stage of the process. Our next example here, we're working with the state of Minnesota. Again, we're working with Code for America here. And we're going back to this question of Medicaid coverage and the use of ex parte or automatic renewal. A follow-on part of this study is to think about how does it affect people's beliefs about government. And so it's sort of two studies combined into one. As we talked about earlier, lots of loss of coverage in the aftermath of the public health emergency. States are legally required to try to increase coverage using ex parte renewals. That is to say, if they have administrative data that demonstrates people are eligible, they're legally supposed to enroll those people or make sure they don't lose coverage. And according to recent data presented by OIRA in their annual time tax report, states have actually been getting better at doing this over time. Why does automatic renewal matter so much? From an administrative burden point of view, it sort of is this like super powerful intervention because it takes all of the burdens, the learning, compliance, and psychological costs, and takes them off the table. You don't have to worry about timing, or you don't have to learn about things, or you don't have to complete forms. It's done for you. So it should feel a lot simpler. It should also increase participation. And again, you look at the Biden customer experience order, they call for expanding automatic renewal to the greatest extent possible. Minnesota was especially interested in whether they could expand automatic renewal for the most vulnerable population, in particular the aged, blind, and disabled population. Here, Code for America is playing a role where they're trying to pull together information from across state systems, put it in one place, also train caseworkers about how to use that information to make correct decisions about who is eligible, and then cases where they don't have enough information to determine if someone is eligible or not. Using that, they were able to determine about 70% of this age, blind, and disabled population. They had enough information to say, this group is eligible. For about 30% of people, they simply did not have enough information. That 30% then has to go back to doing the traditional paperwork process where they have to reconfirm their status. This is just some very basic descriptive statistics of what it looked like before and after for this population. And so there was a month where Minnesota reintroduced the traditional paperwork process in July. And then there was months after where they were doing this ex parte renewal for the age, blind, and disabled population. And these are pretty large effects, right? You're going from 43% or so to just over 80%. So that is a very big effect for that particular population in terms of coverage of Medicaid. There's also some suggestive evidence in the administrative data that automatic renewals have this sort of leveling effect when it comes to disparities and burdens. One of the reasons why we're super interested in burdens is that we think they may reinforce or worsen inequalities. That is to say, some people are going to struggle more with the same set of administrative requirements than others. And that could be for a variety of reasons. It could be for sort of literacy reasons. We've found consistently that people in poor health struggle more with administrative requirements. But again, if you take all of the administrative burdens off the table, that should make it easier for people who struggle more with those burdens get through the process. And there's at least suggestive evidence that that is what happened in Minnesota, where you see black families who traditionally were sort of lower in terms of take-up with the standard paperwork process, having then about the same take-up rate as other families who are negotiating these administrative requirements. So what happens then to these families once they get this coverage? They get covered, that's great. How do they think about that experience? There is an assumption by policymakers that once people have these positive experiences, they should remember those experiences. It should make them feel more positively about government. The flip side of that is if you have bad experiences, like the text I presented earlier, you have more negative views about government. This is sort of built into the Biden customer experience executive order, and politicians talk all the time about ways to improve trust in government, because historically we've seen this long decline and slide in trust in government. The truth is we don't actually have much evidence on this, whether good or bad experiences improves in the long run how you think about government. So we're using the Minnesota example to try and explore this in a little bit more detail. So this is another sneak preview of a paper we're working on. We sent out a survey to those Medicaid clients, and this, again, sort of two categories of clients here. One group has sort of gone through the easy path, automatically renewed. Another group, still within the age-blind and disabled population, who go through the hard part. They have to sort of go through the traditional paperwork process. So we're contacting several months later both of these groups, and we're asking them some very basic questions about how they think about their experiences and how they think about government. Here's what we found. So first of all, we asked them how difficult was the renewal process. And if all of them had said, oh, the process was about 4 out of 5 in terms of difficulty, that would have been very bad news for us, because that would mean that people's survey responses do not reflect their actual experience. But what we do find is that people are able to discern easier and harder experiences. We find a relatively large difference between people who went through the ex parte automatic renewal process and those who went through the paper renewal process in terms of the espoused difficulty that they observed. We also find that people are more positive in their evaluation of Medicaid, and that they have lower burden tolerance. So think about burden tolerance as a concept where we're thinking about why do people have more or less degree of support for adding administrative burdens to programs. And we're measuring burden tolerance here by asking people, do you support automatic renewal? Right. What we find is that if people have experienced automatic renewal, they are somewhat more likely, and it's statistically significant, more likely to also support that automatic renewal. In terms of trust, then, we also ask people, how much do you trust the government to do the right thing for people like you? And again, we're comparing just the base responses between the people who went through the automatic renewal and people who went through the more onerous paperwork process. And we do find statistically significant differences between the two groups. Consistent with what we know about trust in government, people tend to have the lowest trust in the federal government. I'm sorry for any feds who are in the room. And then that trust tends to get higher as you go down to state level and local level. So we see that pattern holds here, but we also see differences if you've gone through the simpler process. Even when you get this survey months later, you're expressing a difference in terms of how you express trust in government relative to those who went through the more onerous process. Now, I'm not going to claim that if you reduce every specific pain point that is going to revolutionize trust in government. I think that's sort of unrealistic. But I do think if you're thinking about critical interactions that people have with government, the sort of moments that matter, and being able to maintain Medicaid coverage is a pretty big deal, especially for the age-blind and disabled population. If you make those experiences better and communicate about those experiences, it may move the needle in how people at least think about those services and those experiences, and it may accumulate to change how they think about their relationship with government. So I'm going to conclude here by observing a couple of lessons here. So I told you about what I think are two success stories that have taken years to develop. And I'm not telling you about all of the research projects that we started that never went anywhere, right? That where everyone was very excited and government wanted us to do a randomized control trial and we thought we'd get the data and then it didn't pan out. And I think it is important to communicate that because for the hits that we develop, there's a lot of investment of time and effort that often does not produce an outcome. And sometimes that's for understandable reason. Government might get cold feet. Administrative data might become less accessible because people raise concerns about things like privacy. There's a lot of work involved when it's successful. It requires usually someone within government who really wants this to succeed, as well as partners like Code for America who are able to bring value to the table and say, here's how we're going to make this service better. Our value added as researchers is to be able to come to government and say, we can tell you if this works or not. Everyone has a success story, but we can tell you if going through a peer review process, establishing causal claims, whether this actually really made a difference. And in the long run, for this movement to be effective, I think you need that credible evidence of success to persuade policymakers to invest resources. The second lesson here is that frameworks help to give us a language to talk about these policy problems and to talk to one another about the administrative burdens that arise in government and how to solve them. Just being able to have those conversations that maybe weren't happening 10 or 15 years ago is a huge part of actually making progress. The third point, I'm an academic, so I'm always going to say this, we need more measurement, we need more research, we need more evidence, right? But I think people in government are also thinking about this as well. How do we measure administrative burdens? How do we measure if these interventions are making a difference? And the final point I want to leave you with is that the Better Government Lab is looking to continue to expand and do this work. We have been benefiting from generous donors, some of whom are in the room, who can enable us to go to government or civic tech folks to say, if you're doing something super interesting, let us help you establish if it actually made a difference or not. So come talk to me or come talk to Seb or those of us working in the lab if you're interested in pursuing work with us in the future. That's all for me. Thank you so much.